Okay, guys, hey, this is Dr. Sean over at Fortis, and we are in week number 5. This is knowledge check number 1. I just want to give you guys a little bit of an extra kind of boost into things. We're going to discuss some of these things in about 6 or 7 minutes, I hope. So we're going to go over this. I have it on my window. I don't know if you can see it right over here on this side. I have the knowledge check 1, week 5. So pull that up if you want to. You can follow right along. We're going to talk about it really quickly. Number 1 here, we're going to talk about the main respiratory muscle, the main muscle for breathing. Now, there's 4 muscles listed here. One of them is called an intercostal. Inter, between, costal means ribs, so in between the ribs. Now, you can get a pinch in these ones, and that can hurt a lot. You can also get a rib out of place where the rib will move and the muscle can spasm around. They're called tsetse syndrome, actually, and costochondritis or some other things. Now, the intercostals, there's different ones. There's internal and external intercostals. They are breathing muscles, but not the main one. They are assisting muscles. They're accessory muscles, basically, for respiration. They help you expand the rib cage itself. And the rib cage expands like this way, right? Okay, that's number 1. So it's not that one. Quadriceps means 4 heads, and it's on the thigh. It's the big muscle on the thigh that helps you push your knee out in there. The quadriceps muscles, if you want to know, is the rectus femoris, which means a straight one on the femur, and there's the lateral vastus. Vast means wide, lateralis on the side, vastus medialis on the middle, and vastus intermedius in between. So there's 4. Now, that's not the breathing muscle at all. If it is, contact me. I want to know how you breathe. The next one is the pectoralis. Now, it doesn't say pectoralis major or minor, and those are actually accessory muscles too, because you can actually collapse and move your chest around. It's really a shoulder movement muscle. There's a pectoralis major goes out to here, and there's a pectoralis minor underneath, which rolls your shoulder forward. Also not respiratory muscle. Diaphragm, that's our big one. That's a big umbrella-shaped muscle underneath the ribs or right above the abdomen. It separates the thoracic and the abdominal cavities from each other. So you have lungs and heart up here and all the gutses and stuff. Now you do have stomach who goes through, but this is our main muscle. As it pulls down, it causes negative pressure, pulls the air in like that. Okay, so we're going to put that one in there. Number 2, what do we got here? What structure connects the mouth and the nose to the lungs? So remember, it goes back this way. And we have the nasopharynx, right? Comes back this way, and then we have the oropharynx and the tongue and all that jazz. And then you have that little punching bag thing in the bottom, but that little thing, you make noise like that. That's called the uvula, UVULA, and it's actually a stop for stuff going up into your schnoz. So when you laugh or cough, when you have rice in your mouth, it doesn't go up in your sinuses, and you spend the rest of the date going like that. So the structure that connects the mouth to the lungs, the alveoli are those little tiny sacs. It means like olives, and they look like a bunch of olives or a bunch of grapes put together. And those are the little air sacs that exchange gases. So it exchanges CO2 and oxygen for when you breathe. Breathe in oxygen, breathe out CO2. Esophagus is the that's the swallowing tube. So when you put something in your mouth and you chew it and you swallow it, it goes down the esophagus. And hopefully the epiglottis, which is a closing thing, keeps it from going into the trachea, which is a big one. The bronchioles actually are further down from the trachea. The trachea is this guy right here. Right, that's a tube that has these like cartilage rings. They're like C-shaped, and they keep it open so I can breathe. Now I don't have to swallow because that's closed, and behind it, the esophagus is posterior. Right. Otherwise, when you swallow things, you see a big lump go down here. That's actually the trachea, and that's the answer for this one is trachea. Bronchioles are the little tubes that are just before the alveoli, so we don't need to worry about that one either. Oh, which part of the respiratory system does gas exchange occur? Ha! We did this one. We have the trachea, that's the tube down the front. The alveoli, that's where gas exchange takes place. We talked about bronchus is the main bronchus. Those are the main tubes, the bronchial tubes that go from the trachea into the lungs. And the larynx is this area through here. So you have the nasolarynx, the nasopharynx, right? Then you have the oropharynx, and then you have the larynx and laryngeal stuff like that. Oop, no, let's do that. Sorry about that. I did that wrong. See, that's how we do. What prevents food from entering the trachea when swallowing? We talked about that too. Cilia is the first one. As you go down the throat, down the esophagus, there's these little finger things that pushing stuff up. And so when you swallow something or you breathe in some dust or a little bit of something, it'll get caught in that because it's sticky, because you got mucus in there and it's wet and all this stuff. And it'll stick to the sides, and those little fingers will push it out, and they'll push it to the esophagus so it can be swallowed down and digested by the stomach. So it's not cilia, it's not the nasal cavity, although nasal cavity will also catch stuff. So the nasal cavity has a couple ridges inside there called turbinates, and that makes the air spin around and warm and become moistened. And you also stick stuff to there, so you won't do it there. And the glottis is an area that you look down and through there you can see a little V opening. That's the glottis. And it is the epiglottis, which is on top of that, that when you swallow down, the tongue pushes down, and this little epiglottis shuts the trachea. So you can push food back into the esophagus, right? And remember, like, so when you swallow, the tongue pushes back and down, and the soft palate, you have the hard palate there, and the soft palate with that little uvula thing, that pushes up so that nothing goes either up or down. It pushes it down that area. And see, we got it right. There we go. We only have a few more to do, I think. I hope. How many do we have in here? There's like 100. No, there's not 100. Which structure divides the nasal cavity into two chambers? That's this side. Here it is, and it goes right or left and right. So the thing in the pharynx is the whole area looking from the side. The sinus is these areas in here. We call them sinuses, but there's open spaces in here. They're behind here. They're back in through here. And those help with resonance, actually, so I can go, and I can feel it through here. The septum, that's the one that does these, and nostrils are the things that you put your fingers in. We're going to put septum for this one, and that should be the right answer. And there we go. That's the right answer. Let's do one more. We're at 6 minutes and 57 seconds. Oh my God. The role of cilia in the respiratory system, we talked about this. They do not produce mucus. They're little goblet cells that produce mucus. And mucus that's the stuff that the dust and stuff sticks to as it gets in there. Remove mucus and trapped particles away from the lungs. Ding, ding, ding. That's what it does. Allows us to speak? No, that's going to be air and the vibration of the vocal cords, okay? And then the exchange of gases, that's going to be the alveoli again. So we're going to put this bop right there. And we probably are almost, come on, are we done almost? Okay, where we go. Windpipe is another name for the structure, not the bronchus. Bronchus are further down. So the windpipe actually is the trachea. The trachea goes all the way down from the nasal and oral pharynx and laryngopharynx down through the voice box, which is here, the Adam's apple if you're a guy, right? And it goes down through those little, like, there's like 20 of those little C-shaped rings, and it splits at a place called carina, C-A-R-I-N-A, the carina, and that turns into the bronchus or bronchioles. Pharynx is not that, it is not the larynx, it is the trachea. That's how it's pronounced sometimes. Can be, trachea. Which pair of organs is the primary site of breathing? Well, it's not the liver. The liver's on the right side, underneath the rib cage, underneath the diaphragm, which we talked about. It is a main filter. The lungs, there's two. There's one on the right and one on the left, and the one on the left, that's this side here with my heart, has 2 lobes because the heart's kind of like pushed over on that side. The right one has 3 lobes, so we'll talk about that later too. The heart, well, that's a blood pump, right in the middle on the left side, above the diaphragm. And the kidneys are retroperitoneal, which means they're behind everything and down below the diaphragm. So we're going to put lungses, and because there's 2 of them, that's the only thing there's 2 of in this diagram here. The voice box is also known not as the trachea, that's the tube. The epiglottis is the foldy thing that closes it so you don't gag on food and swallow food into your windpipe and cough. The larynx, that is where the voice box is located, and then the alveoli is where gas exchange occurs. So we're going to go larynx. And that should be, is that the whole schmear? No, there's still more. My God, we're at 9 minutes. What's the purpose of the mucus produced in the respiratory system? We did talk about this already. I'm sorry for going so fast. If you have to, go back and do stuff. Don't forget to, like, at the end of the video, you're going to look at the bottom and you'll find other videos. So make sure you get these done. So let's see. What is the purpose of mucus? Does not supply oxygen to the blood. That's the alveoli and that stuff. It helps in vocalizing. No, unless you're going to grow stuff. Vocalizing is going to be the voice box. Aids in digestive food. It does not digest. What it does is traps dust and microbes to keep airways clean. That's what it. We're almost done. I see. There we go. Reach out. We got 9 out of 10. We did get that one wrong. Anyway, this is Sean, Dr. Sean, over at Fortis, and this is week 5. I'm giving you guys knowledge check 1. So I just wanted to touch base with everybody. Hope everything is going good. And if it's not, give me a contact. Contact me on Canvas. I know some of you actually didn't have the book to do those kind of things, but these are pretty easy to look up. I'll try and go over maybe the other one and stuff like that a little bit later on. But keep an eye out on the announcements. Don't forget to do those. Discussion boards are looking pretty good, but I want to like make sure that you're answering the 2 other people. And we'll talk to you on the flip side. I can't believe 10.5 minutes, man. Sorry about that. Too long. Bye.